Well, there is a national conversation about body image shaming and how to have healthier conversations around this. It's so important. So we've got Dr. Tran in this weekend. Thanks for coming in.
Yeah, thank you so much.
Love seeing you.
Yeah.
Okay, so this started with Oprah. Can you talk about the conversation she's starting?
Yeah, so Oprah recently stated that she's one of the most criticized celebrities around her weight, but she's leading a conversation that it's now time to release shame around obesity. You know, as a medical weight loss doctor, you know, it's so important that this is a medical disease, much like diabetes or heart problems. So it's time to change the narrative that is obesity is what you have and not what you are.
Okay, you bring up an interesting point, right? Because we've had so many conversations about Ozempic and all of these weight loss medications that people are taking now. How is that influencing these conversations around stigma?
Yeah, we finally know that it's beyond calories in and calories out.
Right.
So as you know, these FDA-approved medications treat one of the top root causes of obesity, which is insulin resistance. So there's clinical evidence to show that it is more than just someone's lifestyle.
Yeah. So does it help the conversation around stigma? I mean, what do you think?
Absolutely. You know, it's so important because I always tell patients there's so many factors like age, gender, medical history, family history, hormones. I tell patients you need to get a full panel of blood work because you need to identify any potential metabolic barriers that could keep you from losing weight.
Right. It's so important because I think a lot of people think it's just as simple as like what I'm eating, but there's always like some of those like almost silent factors that you may not recognize. How hopeful are you that with Oprah bringing this kind of conversation into the mainstream that it will change, you know, people's the way they talk about body image?
Yeah, you know, it's going to be so helpful because I'm telling patients it's really not their fault.
Right.
You need to understand that it's a body chemistry issue. And once you understand the mechanics behind the body, then you can work with a medical specialist, you know, take a holistic approach and really work from the inside out.
It might actually make it a little bit more accessible, right? Or not as daunting because then you don't have to carry, you know, that extra burden of emotion and shame with it.
Yeah, it's time to really let go of that shame and really understand that you can feel empowered. Once you understand the science behind it, you can make your own decisions and actually finally create that healthy lifestyle you're looking for.
I am curious when you do talk to patients and you kind of frame it in that way, or maybe they come to you and say, hey, I'm hearing this, you know, conversation that's happening across the country. I mean, does it change kind of their approach and their perceptions and feelings about this?
100%. I always tell patients, blame the car, not the driver.
Yeah.
And so you really have to just understand, you know, there is chemical processes, there's thyroid problems, there's insulin problems, there's female problems.
Yeah.
But once you fix that, it makes losing weight so much easier.
Right, and you feel a little bit more in control of it.
Yes.
I think it's such an important, especially with social media and all the unrealistic expectations that are put out there, you know, that this is a really, really important realistic look at how to do this the healthy way and the long-standing way.
And there is hope. People do not have to struggle. There is medical treatment, but you don't always have to take medication. There is an understanding of just how things are going in from the inside. But like I said, everything put together, then it just makes it so much easier.
Well, it is nice to have a positive conversation around it, kind of change our perception of it. So I really appreciate you coming in today.
Thank you so much.
Thanks so much.